Imagine a world where a simple scratch could lead to a life-threatening infection because the antibiotics that we rely on no longer work. This is a very real possibility if we do not address the growing threat of antibiotic resistance. In a survey that was conducted through this class, 43% of students stated that they had never heard of antibiotic resistance. Antibiotic resistance occurs when bacteria adapt and become resistant to the antibiotics that are meant to kill them. Understanding the dangers of antibiotic resistance is important because it directly impacts our health and the effectiveness of medical treatments. Antibiotic resistance presents a significant risk to healthcare, emphasizing the immediate need for responsible antibiotic use, the development of new antibiotics, and research for alternative treatments. While preparing for this speech, I reviewed multiple sources through the NC Live database for Wake Tech. These sources include the New England Journal of Medicine, the Lancet Infectious Diseases, Travel Medicine and Infectious Disease, and the National Journal of Physiology, Pharmacy, and Pharmacology. If you're interested in learning more, please visit the works cited slide on my attached PowerPoint. During this presentation, I will explore the causes, the impact, and current efforts to combat antibiotic resistance. The overuse of antibiotics is a significant problem that has led to antibiotic resistance. According to the National Journal of Physiology, Pharmacy, and Pharmacology, between 20% and 50% of antibiotic use is either unnecessary or inappropriate, and decreasing it is a necessary first step to curb antibiotic resistance. When antibiotics are overused, bacteria have more opportunities to adapt, which leads to antibiotics becoming less and less effective over time. The misuse of antibiotics is another factor that contributes to antibiotic resistance. In a survey that I conducted through this class, 37.5% of students said that they were prescribed antibiotics for a misdiagnosed viral infection. Sometimes antibiotics are prescribed incorrectly, such as for viral infections like the common cold, which antibiotics cannot treat. Incomplete courses can occur when somebody does not finish the full course of antibiotics as prescribed. Self-medication can occur when somebody uses leftover antibiotics or somebody else's prescription. The lack of new antibiotics being developed is another concerning cause of antibiotic resistance. According to the New England Journal of Medicine, the retreat of most major pharmaceutical companies from antibiotic research has resulted in little competition in the development of novel antibiotics. As a result, there's been a lack of new antibiotics being made, leading to fewer options to combat resistance. Without new antibiotics, we risk returning to a time when minor infections or routine surgeries could become life-threatening. Now that I've spoken about the causes, I'm going to explore the impact of antibiotic resistance. The health consequences of antibiotic resistance for individuals can be very dangerous. Some of the main consequences are prolonged illnesses, more severe illnesses, and higher healthcare costs. According to the Lancet Infectious Diseases, resistant infections are more expensive to treat, and patients infected with resistant strains of bacteria are more likely to require longer hospitalization and face higher treatment costs than are patients infected with drug-susceptible strains. Higher medical costs can occur because treating resistant infections requires more extensive treatments. The health consequences of antibiotic resistance for communities are significant and can impact the health of many different communities. Some of the consequences include an increased spread of resistant infections and increased mortality rates. Resistant bacteria can spread more easily within communities, leading to outbreaks that are harder to control and treat. In some cases, antibiotic-resistant infections can lead to death, especially if no other treatments are available. The global health impact of antibiotic resistance is significant. Some of the international effects of antibiotic resistance include the spread of resistant bacteria, the impact on low and middle income countries, and increased healthcare costs worldwide. Resistant bacteria can spread around the world, making antibiotic resistance a global issue. Low and middle income countries often have fewer resources to combat antibiotic resistance, leading to higher rates of resistant infections. The economic burden of antibiotic resistance is felt globally, with increased healthcare costs, longer hospital stays, and the need for more expensive treatments. The potential for pandemics due to antibiotic resistance is a serious concern. International travel and trade increases the global spread of pathogen. According to Travel Medicine and Infectious Disease, international travel is not only associated with asymptomatic carriage, but also with an increased risk for community-acquired infections. As bacteria become resistant to antibiotics, there becomes less options for effective treatment. This can lead to higher mortality rates and more severe outbreaks. Now that I've spoken about the impact of antibiotic resistance, I will explore the current efforts to combat resistance. Some important strategies for responsible antibiotic use are to only use them when necessary, complete the full course, avoid self-medication, follow the prescription instructions, and educate patients. Antibiotics should only be prescribed and taken when they are absolutely necessary. They are ineffective against viral infections such as the common cold and the flu. It is important to complete the entire course of antibiotics as prescribed, even if you start feeling better. Stopping treatment early can allow some bacteria to survive and develop resistance. Never use antibiotics without a prescription. Self-medicating can lead to misuse and the increased risk of resistance. Patients should be educated about the importance of taking antibiotics correctly and the risks associated with misuse. According to the New England Journal of Medicine, as the practice of supportive care and empirical prescribing and the uptake of rapid diagnostics and newer antibiotics continue to evolve, so might their effect on survival. By following these strategies, we can help preserve the effectiveness of antibiotics and reduce the spread of resistant bacteria. The research and development of new antibiotics and alternative treatments is very important. Some of the efforts being used to develop new antibiotics are biotechnology startups and new drug approvals. These drugs offer new treatment options for infections that are becoming difficult to manage with existing antibiotics. Some alternative treatments to antibiotics include vaccines and rapid diagnostic tests. Developing vaccines for bacterial infections can significantly reduce the need for antibiotics. If people are vaccinated, they are less likely to get infections that require treatment. According to the New England Journal of Medicine, rapid and reliable pathogen identification and the use of safer and more effective antibiotics probably reduces death by improving survival rates among infected people. This shows how improving diagnostic tests can help doctors determine the cause of infection more quickly, allowing for more targeted antibiotic use and reducing unnecessary prescriptions. To sum it all up, antibiotic resistance presents a significant risk to healthcare, emphasizing the immediate need for responsible antibiotic use, the development of new antibiotics, and research for alternative treatments. Antibiotic resistance is a major concern that is driven by the overuse and misuse of antibiotics, along with the lack of new antibiotic developments. Antibiotic resistance leads to prolonged and severe illnesses, increased healthcare costs, and the spread of resistant bacteria globally. Current efforts to combat antibiotic resistance include promoting responsible antibiotic use and investing in research and development of new antibiotics and alternative treatments. What are some ways you think that we can help combat antibiotic resistance in our daily lives? We can help combat antibiotic resistance by using antibiotics only when prescribed by a healthcare professional, completing the full course of treatment, and never sharing or using leftover antibiotics. Let's all take responsibility in the fight against antibiotic resistance. Follow these practices, spread awareness in your community, and support research for developing new treatments. Together, we can make a significant impact on public health.